In the last video, we talked about the general anatomy of the abdomen. We talked about how a lot of things within the abdomen are very cramped, and you have a bunch of different organ systems within that same area. And so it is very important for this section to know to have a general sense of what the anatomy of the area is. In the thoracic cavity, when we talked about chest pain, it's a little bit easier because there's not a ton in there. Versus here in the abdomen, I mean, you have the liver, the gallbladder, the stomach, the spleen, the kidneys, the adrenals, your pancreas, your duodenum, jejunum, ileum. You have your colon. So, and then you have your vessels over there, and then you have the muscles in the wall of the abdomen. Then you have your spine in the back. And you have your reproductive organs back here. So like I said, there's a lot. So having a good idea of what is in the area is going to be important going forward as we talk about what's going on and what's causing abdominal pain, because the way that I split it up was based off anatomy. Because in general, these organ systems are going to cause pain when they're affected whenever in the same area that they are housed. So the liver is going to be more right upper quadrant, same with the gallbladder. Spleen is going to be more left upper quadrant. And I mean, your kidneys are towards the back, so you'll feel it more in the back and in the flank. So take some time with that last video. You don't have to memorize it. You can have these diagrams available to you as we go through the cases, as you learn the material. The only time I ask that you don't have diagrams like this open is for the quizzes, because I want to get what your baseline is. And remember, the quizzes aren't for any grades. It's not going to change anything about your participation in the class. So having said that, let's go ahead and talk about how we're going to be breaking up this monster of a lecture. So there's two ways I'm going to break up abdominal pain. One is going to be by location, so the right upper quadrant, left upper quadrant, right lower, left lower. The second is going to be surgical versus non-surgical, and that's important to know because surgical causes of abdominal pain are things that can kill you very quickly, and that's why you need to get a surgeon involved to get them to open up the area, take care of what they need to take care of, and close you back up and hopefully save your life. Versus non-surgical, we have a little bit more time. It's more medication treatment versus, a lot of times it's just supportive treatment. But it's important to be able to distinguish, what are the surgical causes, what are the non-surgical causes of abdominal pain, and what are some of the signs and symptoms that point you to one or the other. And so with having said that, we're going to first talk about the extra abdominal causes of abdominal pain, so things outside the abdomen. Then we're going to talk only about the surgical causes. And then, as you see here, we break it up into different quadrants. And then we're going to talk about the non-surgical causes, which, as you see here, again, are broken up into quadrants. And so, as we go through this, you're going to see that some of the things are the same. So, for instance, perforated anything is going to cause pain wherever that anything is, or it can cause diffuse pain. So, if you perforate the bowel here, you open up that bowel, and so stool is being released into the peritoneal cavity, into the abdominal cavity. It's going to irritate the area. It can cause an infection, and so either you're going to have pain wherever that spills out, or you're going to have diffuse pain when your peritoneum is irritated. And so let's first talk about the extra abdominal causes of abdominal pain. And so the extra abdominal causes are actually pretty simple. It's what we've talked about before. It's your myocardial infarction, it's pericarditis or myocarditis, so inflammation of the pericardium surrounding the heart or the actual heart muscle itself. The pneumonias are going to cause it, can cause abdominal pain, and then testicular torsion. So if we look at the anatomy, if we're talking about myocardial infarction, your heart is kind of sitting in this area. And it brings blood down here. But if you have an MI, well, you can irritate this area, and that can feel kind of like your epigastric region or your left upper quadrant. Now, for pericarditis, myocarditis, it's that same thing. Your heart's going to be right here. You're going to inflame this outside, and so you can end up having pain that is in this general area. So it's going to be upper abdominal pain. Sometimes it's going to be epigastric. Sometimes it's going to be left upper. Now, pneumonia is interesting because the only real way to get pneumonia or pain from pneumonia is if it's going to be happening in these lower lung fields. And so you should think of somebody having abdominal pain because of pneumonia if they're coming in with a cough, shortness of breath, they've been having a fever, they had a recent urinary upper respiratory infection, and so pneumonia is going to only be relevant when it's kind of here in these lower lobes, and it refers to this upper abdomen. Depending on the side, it's going to be right upper quadrant versus left upper quadrant. And then lastly here for the extra abdominal causes we're going to be talking about in this course is testicular torsion. And so if we think about the scrotum down here, your testicles sit in the scrotum, and then you have your penis and all that. So, but the testicles actually descended from inside the abdominal cavity. And so if anything happens to the testicles, you're going to feel them. You're going to feel it up here. And so males with vague abdominal pain that have usually I believe it was the left, but you have one of the testicles kind of laying on its side like this versus the other one's up and down, and then you can't really reduce the one that's like this back to the up and down position. A lot of times it's because the testicle has a bunch of veins and arteries and stuff like that attached to it, and so what can happen is that these veins and arteries supply the actual testicle itself. So if it wraps around that, you can end up with this kind of sideways looking testicle. But what's more important is that all of these veins have now coiled around each other, and these arteries have coiled around each other. And so all of this supply has been cut off. And so you're causing your testicle to be basically starved of oxygen and nutrients, and so it can die. And so because the testicle originated from the abdominal cavity, this pain is usually referred to as vague abdominal pain. And so if you have a young kid that has abdominal pain that's vague, can't really figure it out, well, you should check a genital check. You should make sure that there is no torsion. And we will talk about each of these more or less in future videos, but this is kind of just a general overview. So we have things like your heart's going to cause extra abdominal pain, you have your lungs, and then we talked about the scrotum or the testicles. So those are extra abdominal causes. So let's go into breaking it up into surgical versus non-surgical. So surgical versus non-surgical is simple enough. These are the surgical basically are the things that are so severe and so life-threatening that we have to take care of now. So for instance, things that cause diffuse abdominal pain that can be surgical or something like an aortic dissection, where we talked about in the past, where this aorta here dissects, and so you end up with this false lumen and just keeps tearing downwards. And it can cause some hypotension. It can cause some severe tearing like pain coming down. The big thing though with an aortic dissection, the thing you need to remember is if this part of the vessel over here that has a thinner wall now gets broken, well, now you're spilling blood all outside of your vessels into your abdominal cavity, and you can die pretty quickly of a aortic rupture because most of your volume of blood is traveling through the aorta, and so it's going to want to leak out because it's such a high pressure system. So aortic dissection is one of them. Same thing with a ruptured aortic aneurysm. And so the difference between an aneurysm and a dissection is the dissection, you have this vessel and you're kind of dissecting between these two layers and spilling blood in that way. With an aortic aneurysm, it's basically a ballooning out of the vessel. So if this was the vessel here, now you have this balloon. And the same thing with the dissection, the wall is going to be a little bit weaker, and so that aneurysm can rupture, and the same thing's going to happen. You're going to be spilling blood into the area. And then the last one that causes diffuse type pain is a bowel perforation or peritoneal type pain. So basically anywhere in this GI tract, from the stomach all the way to the intestine, going down to the rectum and out the anus, any of those can rupture. And if they rupture, you're spilling contents into your abdominal cavity. So a lot of times this is stool. So you're taking something inherently dirty and putting it into a sterile area that is your abdomen. You're just asking for a really bad infection. So anytime you have a bowel perforation or a like something like necrosis where the blood supply to part of the bowel gets cut off, and so this part of the bowel is now dying, and so it's going to undergo necrosis, and so a surgeon's going to have to come in and excise this portion, and we'll reconnect those two. And so anything like that where you perforate the bowel is going to cause pretty severe pain. You're going to have signs of surgical abdomen, meaning like rebound tenderness, and sometimes it can be pretty rigid as well. And you're going to want to consult a surgeon as soon as you can for these, and really for any of these. So in the right upper quadrant, we have perforated ulcers. Well, first we have perforated ulcers. So we're talking about in your stomach and in your duodenum, where if you have high acid content of your stomach or your duodenum, or you have gastritis or peptic ulcer disease, and you form this ulcer here, well, if it keeps damaging the stomach lining, well, you can perforate entirely through that stomach and or the duodenum, and the same thing, you're spilling gastric contents or you're spilling intestinal contents into the abdominal cavity, and that can be pretty dangerous. The next is cholecystitis, and a lot of you have probably heard what cholecystitis is. It's just inflammation of the gallbladder, and so the gallbladder kind of sits right here behind the liver, underneath the liver, and it's important because the gallbladder helps store the bile that the liver makes, and it helps break down fatty type foods. And so what ends up happening is if you have a gallbladder that is making stones, and those stones get stuck in the outlet of the gallbladder, well, now you've blocked off a organ that's supposed to be draining. And whenever you have something that is supposed to be draining and isn't draining, you're just setting it up for an infection. And so if this gallbladder becomes infected and inflamed and there's fluid around it when you do an ultrasound, a surgeon's going to have to come in and take that out, especially if you're starting to look unstable or you have it looks like you have a pretty severe infection. And the last one that I have down here for surgical abdomen in the right upper quadrant is appendicitis in pregnancy. And I think I've talked about it a little bit before, is if you have your uterus here, as you get pregnant, this uterus is going to grow. And as it grows, you're kind of pushing all of these organs upwards. Well, if you're pushing all the organs upwards, this little appendix here is going to also move upwards as well. And so a lot of times you're going to have appendix type pain in somebody who's pregnant, but in the third trimester, as you're going to have that pain kind of here in the mid abdomen, or you can have it in the right upper abdomen. It's not consistent, and people are going to tell you that they have pain in different areas, so you always want to keep it in the back of your mind. Now, so that was the right upper quadrant here. Looking at the right lower quadrant, you can perforate a bowel and spill poop into your abdominal cavity. Ectopic pregnancy is a super important one because it can cause a lot of mortality. And so if you have a young person coming in who's of childbearing age and they're complaining of abdominal pain, especially here in this lower segment, and a lot of times they'll have some vaginal bleeding or something like that, if it's a woman of reproductive age, you should always, always, always check a urine pregnancy, because the last thing that you want is to miss a pregnancy and order a CT scan, and now you've irradiated this baby, and you can cause a lot of potential issues going forward. And so that's one reason why the other more pressing reason and why this ectopic pregnancy is in the surgical abdomen portion is because an ectopic pregnancy, if it's in the tubes that connect the uterus to the ovaries, so these are ovaries here. If it's in these tubes, well, those tubes can't support a actual pregnancy, and so you'll have an embryo kind of implanting here, and as it grows, you're pushing these fallopian tubes, and as you push, you basically form a lot of distension within that fallopian tube, and eventually it's going to rupture. And as it ruptures, you can have significant amounts of bleeding. You can bleed so much to the point where the patient is now unstable. And if the patient is unstable, well, that's a surgical emergency. And so you're going to have to go in and remove that ectopic pregnancy. Next, we have an incarcerated hernia. So a hernia is basically a weakness in the abdominal wall. And so if you have these muscle fibers kind of coming down here, and you can pretend this is your anterior wall, if you have this weakness here, part of the bowel can come and just push itself out here. And so if we take it from this view, so this is your abdominal wall, you have a weakness, and your bowel comes out and kind of sits out here and then communicates to the rest of the abdomen there. And so this portion that's communicating out is what's a problem, because if this abdominal wall here now cuts off blood supply to this to that portion of the bowel that's sticking out, well, that bowel can die. And so whenever you cut off blood supply to something, you're basically gonna kill it. And so unless a surgeon goes in and opens that up and reduces it back and probably puts a mesh in there, you're gonna be prone to strangulating or incarcerating that hernia. And if that happens, then you are at a higher risk of causing necrosis to the bowel. And when any bowel that is dead or underwent necrosis, you have to cut it out. And so surgeons are going to go in and evaluate, see if there's dead bowel. If there's dead bowel, they'll try to cut it out. If not, they'll reduce it, push it back into the abdominal cavity, and then put a mesh there so that it doesn't happen again. So that was a hernia. And then the last one in the right lower quadrant, probably the most important and the one that you're going to see the most in your career, is appendicitis. And so like we said before, this little appendage right here is your appendix. And so it's on the right side, it's in the right lower portion. And what ends up happening is that little thing hanging off the bottom, well, it communicates with the colon. And if something gets stuck right here, right at that opening of the appendix, you're gonna have a block off of a structure in the abdomen. And so whenever you block something off that's supposed to be able to drain out, you're causing a nidus of infection, and you're making it easier for infections to take their foot. And so it's going to be important with somebody with left lower quadrant abdominal pain to evaluate if it's the appendix, because that's something that can be a surgical emergency. There are some studies that show that IV antibiotics can be just as good as having surgical outcomes or doing surgery. But the problem with that, though, is that if you have appendicitis and you elect to treat with IV antibiotics, well, if that person has a recurrence of their symptoms, are you going to treat with antibiotics again, or are you going to just go ahead and take it out? And so a lot of surgeons will just go ahead and take it out the first time so they don't have to deal with that, because if you leave that there, you've had appendicitis before, you're at a higher risk of developing it. So just something to keep in mind. All right, now looking at the left side. So we just talked about the right side. Now we're going to be talking about this side over here on the left. And so you see on the left, there is pretty much your stomach, your kidneys, your pancreas can be a bit there. Your spleen is the big one in the right upper quadrant. And then a lot of this area is taken up by colon. And so, like we said before, anytime you perforate something, if you perforate your bowel, if you perforate your gallbladder, whatever it is, you're going to have pain in that area. If it's severe and you're perforating contents that aren't supposed to be in the peritoneal cavity, meaning like stool or even belly or blood, you are going to cause a lot of irritation in this area. And instead of having a specific pain exactly where the perforation was, you can have more generalized type pain. But a lot of times you will still retain that most tender point in the area where that occurred. And so in the left upper quadrant, we're looking at this portion right here. Any type of perforation of the stomach and parts of the large intestine, those will cause some pain. And then the other one is splenic rupture. And like I said before, the spleen is a highly vascular organ. And so if you do rupture it or you injure it, it will cause bleeding. And so the classic scenario where we see splenic rupture is when you have a a teenage kid that develops EBV, which is a type of virus, Epstein-Barr virus, and gets infectious mononucleosis, and that causes hypertrophy of the spleen. And so the spleen gets larger than it's supposed to be. And when it gets larger than it's supposed to be, the capsule stretches and it becomes more prone to injury. So it gets a bit bigger. And what we typically tell patients is do not go and play contact sports. So if you go and play football when your spleen is this big and somebody comes and hits you on this left side over here, well, you're going to be more prone to having that splenic rupture. And if you have a splenic rupture, well, now you're bleeding into your abdominal cavity over here. And so splenic rupture will cause left upper quadrant pain. Even without a rupture, you can have splenomegaly, meaning a bigger spleen, and that can cause some pain too, but splenomegaly is not a surgical cause of abdominal pain. The splenic rupture will be, though. And then going down to the left lower quadrant, it's the same thing. Bowel perforation is the one thing that we talk about. An ectopic pregnancy, like we talked about before, the pelvis area is where the ovaries sit, and then your uterus is over here. And so if you have a pregnancy that instead of going into the ovary itself, in the uterus itself, it sits here in this tube, well, that tube is not for pregnancy. You can't develop a pregnancy. And so the lining of the fallopian tube, the muscle is actually it's not as strong as the uterus itself. And so it will distend until it can't distend anymore, and then it'll rupture, and then you'll start to have some significant bleeding in the area. And so that is a surgical emergency. People can die very quickly if it's not taken care of. And then, so I said ectopic pregnancy. The ectopic part isn't going to kill you. A ruptured ectopic is going to potentially kill you. And then the last one is ovarian torsion. You can have this on the right side as well, but if you have your ovaries over here, your ovaries are suspended by a bunch of ligaments. And in those ligaments, there's the blood supply to the ovary itself. And so kind of like testicular torsion, if you have your ovary here and you have the blood supply here and it twists on its own blood supply, well, now you've created the opportunity for that ovary to die. So let's say this is your ovary and now you twist it and so that blood supply is gone. Anything that doesn't get blood supply, doesn't get the nutrients, it doesn't get the oxygen, cannot survive. And so your ovary will potentially die if it starts to twist on itself. And so the hard thing about ovarian torsion, though, is that it can be very subtle. It's a cramping abdominal pain. It can be severe. It can be or it can just be very, very uncomfortable. As it progresses, it'll become more severe. But think of how many things are in this area over here. You can have appendicitis that looks like an ovarian torsion. You can have something like diverticulitis, which is more on this side, causing ovarian torsion. And so it is a very difficult thing to diagnose, but if anybody comes in with lower abdominal pain, and especially if they're of reproductive age, you're going to get a ultrasound of the pelvis to see, if they have an ectopic pregnancy, but also you want to evaluate for a torsion. And so what they would do is they would go in to the cavity and they would try to untorse, so uncoil the ovary on itself, and then they would tack down the ligaments that are holding the ovary so that it doesn't have the opportunity to turn anymore. And so those are generally the things that we'll see on the left side. So we have the spleen, we have bowel perforation, same thing with the stomach, and you have your ectopic pregnancies over here on both sides, and then torsion can be on both sides as well. There are, of course, other things in the area, but focusing on what are the surgical causes, these are the ones that we're going to focus on for this class.